Okay, so what I'm going to do today is do a physical assessment on Miss Tittles. She is a 15-year-old spayed female pug. Um, the only disease process she has going on is arthritis, otherwise very healthy. So the first thing I'm going to do is look at her gums, make sure they're nice and pink. I'll check the capillary refill time, less than 2. They're moist. She does have some plaque. It's pretty minimal. Next thing I'm going to do is listen to her heart sounds and her lung sounds. So her lung sounds are clear, her heart sounds are normal. I'm going to listen to her heart while palpating her femoral pulse. Make sure that those are in sync. All right, her heart rate is 126. Her heartbeat and her femoral pulse are in sync. Next thing I'm going to do is count respirations. Okay, I've got that at 30. And last step is I'm going to take a temperature. Okay, temp is 99.8. Okay, so for the physical status classification, I would give for Miss Tittles, she is a normal healthy dog, but since she is geriatric, I would give her a level of PS2, but she does not have any underlying disease other than arthritis, which is pretty normal for a dog her age. So that is how you do a physical assessment on a dog and classify them on the physical status classification system. Okay, so now I'm going to perform a physical assessment on a cat. This is Bugsy. He is a 19-year-old neutered male domestic shorthair. He also, fortunately, is a pretty healthy cat. Routinely gets very good blood work results, and he has no underlying health diseases. So the first thing I'm going to do is I'm going to look at his gums, check his capillary refill time. He does have nice pink moist gums. CRT is less than 2. He does have a little bit of gingivitis, but pretty minimal plaque on his teeth. So what I'm going to do now is listen to his heart and lung sounds, and I'm going to get his heart rate as well. Okay, so I got a heart rate of 150. Going to listen to his heart while I palpate the femoral pulse. Okay, those are in sync. His lung sounds are very clear. So his respirations, I've got 24. Last thing I'm going to do is get a temperature. Okay, I got 99.4. So, overall, very good exam. He, again, he's 19, but does not have any underlying disease processes. So I would give him a classification of a level 2 because of his age. So if I heard something like a murmur on either a cat or a dog, I would definitely report that to the doctor. We would probably want to do an EKG and maybe even have the animal see a cardiologist for workup. If the lung sounds were not clear, we would probably do possibly some x-rays and even a thoracic ultrasound to see if maybe there's some pleural effusion, or in the case of the x-rays, maybe some sort of diffuse pattern in there that would indicate some sort of lung disease or fungal infection. Other than that, I'd say it was a pretty good assessment, and that is how you do a physical assessment on a dog and a cat, and give them a physical status classification. Alright, so I'm going to try to draw some blood here on the cephalic vein of this dog. Got my alcohol on the leg. I'm using a 1 ml syringe. Alright, so going in, bevel up.
Don't eat me,
please. Alright, so I got a little bit of blood, enough for a blood sugar. That's how you draw from the cephalic vein. Okay, so I'm going to draw from the jugular vein on this kitty here. I shaved a little bit so I can get a better feel. Okay, so we're gonna draw blood from this jugular vein. We shaved a little area and put some alcohol on it. All right, here we go. Oh, come on, it's shallow, yep. All right, ready? Okay, and that's how you draw from the jugular vein. So what I'm going to discuss for this video is an appropriate anesthetic and peri-anesthetic protocol for the patient for the procedure that's being performed. What I'm going to discuss here is the protocol for older cats. We did 2 dentals on 2 cats. One was 14, one was 15. So what we will be using for these guys is neurolept analgesia, which is a profound state of sedation using a tranquilizer and an opioid. We will be using midazolam, which is a benzodiazepine as a mild tranquilizer, and then we will be using buprenex as an opioid for analgesia. So those 2 medications will be given together in an intramuscular injection, and then we will induce anesthesia with propofol given to effect. And because these cats are older, we will be using smaller doses of the midazolam and the buprenex.
Go.
Okay, so what I'm going to discuss today is an esophageal stethoscope. It is very similar to this. This is an esophageal cardiac monitor. How you use this is you put lubrication on the knobs on here. You pull the tongue out, open the mouth, and you slide this right down into the esophagus, not the trachea. And when you get that down it will start to pick up the ECG. So for the esophageal stethoscope, it's the exact same thing, only you can hook up a stethoscope to it and hear the heart rate throughout the entire procedure. The other thing is gastric intubation. It is an oral gastric tube. It's a little bit bigger than an ET tube, and you put it down the esophagus. It's mainly used for decompression for GDVs and for gastric lavage when dogs may eat something like raw red dough that has not risen yet. We will often place that into the esophagus, down into the stomach, and lavage to remove that. And that is how you place an esophageal stethoscope and a gastric intubation. So I'm going to perform an EKG right now. So we have this mobile unit. An EKG tells us about the electrical conduction within the heart. So what we're going to do is we have these 3 leads. This white one goes on the right forelimb. I'm going to put it just a little bit below the elbow. It's a little alligator clamp. Okay, the black lead goes on the left forelimb. I'm going to go right below the elbow. And the red lead goes on the left hind limb, and I'll clip it right below the knee. So you need to wet the leads down. We use alcohol.
It's cold.
So what we have the dog on a towel to minimize any other conductions. We don't want any other equipment being used. If the dog's shaking, that could give us a false reading. But she's very calm right now in right lateral, and that's the ideal position. All right. So when you're trying to read an ECG tracing, there are 5 questions you want to ask. Is there a P wave before every QRS complex? Is there a QRS complex behind every P wave? Are all the P waves in QRS complexes the same? Are the PR intervals normal in duration, and are they the same? And are the RR intervals the same? Okay, so if you look right here, this is our QRS complex. You can see there's a tiny P wave a little bit before the QRS. There is one before every QRS complex here, and there is a QRS after every P wave. And are all the P waves and QRS complexes the same? Without printing this out and actually measuring it, which would be ideal, but so it does appear that all of the P waves and QRS complexes are the same. Are all the PR intervals normal in duration? Again, it would be best to print out the ECG and measure it, but just by looking at this as it's going, they do appear to be the same. Also for the RR intervals, there does appear to be the same amount of time between each beat. So this is a normal sinus rhythm, heart rate of 90, and that is how you perform an ECG. So for the part of my video discussing in section 3.3 endotracheal tubes, including how to select the correct size and check it for leaks, I am going to refer to the part in the video in 5.3 where I show how to choose the correct size and check for leaks. Okay, so what I'm going to do now is a subcutaneous injection. We just put IV or sub-Q fluids up here between the shoulder blades, so I'm going to go back here. What I'm going to do is have Bevel up. I'm going to lift up his skin I don't want to go in the muscle. I want to go in this pockety area. So I'm going to lift up the skin. I'm going to go parallel with the body. I don't want to go down. I'm going to draw back to make sure I didn't get in any blood vessels. And then I am going to give the injection. And that is how you give a subcutaneous injection. All right, so I need to give meropitant and butorphanol intravenously. I'm going to use the lateral saphenous vein. I'm going to use this butterfly to do it since it's 2 medications. I'm going to prime the line. Okay. Ready, here we go. Come on. There we go. All right. I'm going to give my meropitant. Okay. Going to use my flush again, flush the line to get the meropitant in. All right, I'm going to clamp the line again. This is the butorphanol. Like that. And back to flushing the line.
Is someone getting a triage?
Okay. She's going home.
Hey, Daly.
Okay, so this is the monitoring device. Sorry, Ellen. We use SmartFlow. So every 5 minutes, we record the blood pressure, systolic, diastolic, the mean arterial pressure, the heart rate, pulse quality, SpO2, temperature. We monitor the isoflurane percent and the oxygen flow meter, and then what the fluids are at. So these are the systems. I've gone through these before in other sections of our video, so now I'm going to monitor this dental procedure a little bit.